morning, everyone. Thank you for joining us. We are going to start, but before we do that, I do want to let everybody know that we are recording this webinar. So we will make it available on all our local town health department websites and on government access stations. So if you have to leave in the middle, if you know somebody who was unable to be here with us, we can definitely share that with them. So I want to just let everybody know that. Want to welcome you to our Region 1 Mental Health webinar series, Mental Health in a Post-COVID World. I'm Sue Giacozzi, and I'm one of the regional coordinators for Region 1. For those who aren't familiar with Region 1, we are local health departments that cover the 14 towns from Stratford all the way to Greenwich. Before we get started, I do want to say thank you to all of you for joining us, and a special thank you to our presenters who are taking the time out to share their information with us, to the Fairfield Fire Training School who's hosting us tonight, as well as for the town of Fairfield for helping to set all of this up, and all our local health departments in the region who have supported this effort and who have seen the importance of addressing the mental health needs in our communities. As we go through, we're going to hold questions to the end so we have time for our presenters to provide their information, but please put them in the chat and we're going to be monitoring the chat and we're going to try to get to all of those questions at the end. I'm going to turn this over to Santina Jaranko from the Fairfield Health Department, who is going to introduce our speakers.
Thank you, everyone. So our first speaker is Margaret Watt from Positive Directions. She is the Prevention Director at Positive Directions, the Center for Prevention and Counseling, where she also directs the statewide Young Adult Mental Health Project, Turning Point, Connecticut. She has been a regional leader in behavioral health for 10 years, having previously served as co-director of the Hub and executive director of the Southwest Regional Mental Health Board. Currently, her prevention work focuses on Norwalk and Westport, as she leads statewide mental health advocacy efforts as public policy chair of NAMI, Connecticut. So I am Margaret. Thank you for being here today with us.
Thank you, Santina. And hi, everybody. Good evening. Thanks for spending your evening on a topic that's kind of painful and super related to each and every one of us at this point in time in the post-pandemic phase. So we're going to be talking about mental health with a focus on our youth, our kids, and our teens. It is no surprise to anyone here that our kids have been struggling and have been struggling for a while. So when we're talking about mental health, I think what we're really talking about is the kids who are struggling with mental illness, right? That could look like anxiety, it can look like depression, it can be, borderline. We have increasing numbers of kids, by the way, dealing with psychosis as a result of using cannabis, which is marijuana. So what I'm going to be covering tonight is a little bit of, what are the trends and what are the current statistics? And I'm assuming we have parents here tonight, and you may be worried about your own kid or someone in your family. I also want to acknowledge that even if we're talking about kids, everybody here as an adult, we are still living with the mental health impacts of COVID ourselves. We may have already been dealing with mental illness ourselves. And so the resources that you're all going to hear about tonight, everybody here and all the health departments and town social services departments, we're all available to help. Help is available and people are not alone in this struggle. But it is a real issue for so many. So Santina, you gave a great introduction. So I'm just going to go ahead and ask for my next slide. Thanks. Let's talk trends first, because we all, there's so much discussion around the mental health post-COVID. But here is a quote from a video that you can find online by the American Psychiatric Association. The video is called "Our Kids Are Not Okay." And the link here on the screen is the written report. And they were talking about an issue that we know very well in the behavioral health community, which is children's mental health, youth mental health has been worsening for some time. So in the 10 years prior to the pandemic, feelings of persistent sadness and hopelessness, which is the definition used for depression when you survey people, as well as suicidal thoughts and behaviors, increased by about 40% among young people. That was CDC data. And so that was happening, and then COVID came along, and COVID made things worse. let's look at the next slide and talk about why has mental health been getting worse. There are a lot of factors. I'm a big believer in the iPhone theory. If you haven't read, I don't know how to pronounce her last name. It's either Jean Twenge or Jean Twenge. She's a child psychologist, I believe, out of Colorado, who's been researching children's mental health for years. And she has tons of trend data that really looks like the introduction of phones, which put social media, of like the iPhones, which put social media in kids' hands at all times, and all the other factors that go along with screen time. Since around the introduction of that level of access to internet and social media, we've seen a worsening in youth mental health. But what else has been going on in the last 10, 15 years? There's been school shootings. Our kids are, experiencing the fear that there's someone in the building, or the lockdown threats and all that. There's been climate change. Our political situation that our kids have grown up with has been pretty toxic. And those are things that have been going on for a while. The data shows us that the impacts of all of this seem to be worse on girls and on the LGBTQ population. And I'll show you some actual statistics in a couple minutes. But it's a tough time to be a kid. I'm glad I'm not a kid right now. Our teens are really struggling. And if you can click again, please, let's look at what made things worse with COVID. So a really significant number of young people in this country lost a family member during COVID. Another significant number had a family go through the stress or trauma of losing a job or not being able to pay for resources, during a significant period of time. A really scary percent of kids are thought to have experienced emotional abuse during COVID when they're locked down, the pandemic, possibly 55%, and another 11% experiencing physical abuse. So if those were things that were going on prior to COVID, but now you're stuck in the household with an abuser, that's clearly going to leave scars. And obviously the disruption in schooling and daily life which affected all of us, but for kids, whether they're in elementary, middle, or high school, those were years where they were supposed to be learning how to develop relationships with others, gaining a sense of, personal identity, just growing and learning, all of which is social, and the social part was taken away. And they are still struggling with that today. So next, please. Now, this is the first of a few slides I'm going to show you from Norwalk data, because the Norwalk Health Department is one of the main groups represented here today. And because we just conducted a youth survey in Norwalk in October and had conducted the previous one back a year and a half prior. So we're going to use this as just some samples of data that are really local to our area. And this is just another one to show that in addition to the factors we've identified, a lot of kids are experiencing what we call toxic stress. They've seen violence, they've experienced discrimination, they have factors in the house that are, housing or food insecurity. There are all kinds of traumas that any or all of us could experience. So when we're talking about why kids are struggling, there's a lot. But that's sort of bad news, and there are ways to try to help mitigate that, and that's what we're going to talk about tonight. So let me just share a few statistics, and I'm going to start with some Connecticut and then again, examples from Norwalk. What's happening in Connecticut? So the 2023 State of Mental Health in America says in Connecticut, basically 16% of our youth reported at least one major depressive episode in the last year. And of those, more than 40% didn't get any kind of treatment. Our state's mobile crisis system saw an increase in calls, and the Kids in Crisis Helpline saw a 19% increase in calls, including more kids calling themselves on their own behalf. And the next piece of data is from the 2022 Connecticut Schools Health Survey. So these are two kind of statewide snapshots that we get, where and usually the data is reporting on what happened the prior year. So more than a third of high school students reported depression, and 29% reported poor mental health in the past month. So some said depression, some said poor mental health. And then this is just to show you how different the data is when you disaggregate it and look at high risk groups. And repeatedly in all of our surveys, the LGBTQ identifying population and girls tend to be at much higher risk for depression, anxiety, and so forth. So now I'm going to share some of the Norwalk data. Again, this is an example. Norwalk is a more urban community than some of the suburbs around here. It may be more diverse racially and ethnically than some of the communities, but I think a lot of the trends that we're seeing in Norwalk are similar in other communities. So this first one is just to show you something that's really important to think about with our kids. And if you're a parent, these may be things your kids are thinking about a lot, and maybe they're not talking about it with you, and maybe that's a conversation you should have. But students, as you can see here, basically 5% of students don't identify on the male-female continuum, but rather as trans or non-binary, or they're not sure of their gender identity. This is not the first survey where we find that less than close to 3/4 of kids identify as straight or heterosexual. And that means that there's a really significant chunk of kids in our communities that identify as something else. Right now, this survey showed that the next most chosen, not popular, that's the wrong word, sexual identity was bisexual or pansexual. But there's a whole range of sexual identities that kids can and do identify with. And I think for a lot of adults, it's a complicated topic that they don't understand. And the best way to understand is to ask. Kids are absolutely talking about this at very young ages. They're seeing it on social media. It has really important meaning to them. We'll go on to the next slide here. I just wanted to talk about that because these things are related to their mental health. So, wanted to bring some good news here. As I said, in Norwalk, we surveyed 18 months apart, and we actually saw a really good direction in the percent of kids reporting depression. So what you see here is in 2021, of all of our 7th through 12th graders, 39% reported depression, and then this year it was 23%. That's a terrific jump in the right direction. Those who had suicidal ideation, meaning they'd thought about it, that dropped also, although the same percent of kids attempted suicide. And I know that's scary. 6% of the kids across 7th through 12th grade attempted suicide. Let me say this, even though some of this is going in the right direction, we don't want 23% of our kids to be depressed. And that's overall. It's a higher percent for certain higher risk groups, right? The kids, but what this shows is that people are resilient, right? We can bounce back. Sometimes we need a little more help. But most kids are getting better. Those who are still really depressed, the clinicians among us will tell you, they are more acutely symptomatic. They are struggling a lot more than kids who had depression prior to the pandemic. So there's a lot of need there. One thing that we're also seeing is kids are reporting anxiety a little more than depression now. So as the depression lifts, there's just school is a scary place to be when you are out of it for a couple of years and you don't know how to relate to your peers. So there's newer things that are emerging. And some of that's on the next slide. So just to look at this year's data rather than a comparison, we now in Norwalk had 27% of kids saying that they felt high levels of anxiety almost all the time or all the time, and that it affected their life almost always or always. So those are kids who are not available to learn, right? They're not in a place where they can just breathe and learn to connect with others. 23% now reporting depression. You can go ahead and click, thanks. 11% this year said they'd considered suicide. And then 2 other pieces of data that we don't have for all of our local communities, but 12% were reporting self-harm. So if you're thinking about that in terms of some kids, self-harm may be suicidal, maybe suicide related, and it may not be, but so it's always important to investigate. It's definitely it's a mechanism people use to cope with their inner feelings by putting the pain outward on their body. It's a negative coping skill. There are other things that people can learn to do. And sometimes it is intended to harm them in a permanent way. The newer thing that we gathered was because we're seeing it, clinicians are seeing so many reports of disordered eating that we asked, and over a third of kids reported irregular eating behaviors. So that is a concern to look at. That's boys and girls. And, you know, sometimes food, you know, eating disorders could look like, you know, calorie counting or binging and purging. And it can also look like working out insanely in the gym, right? And it's like, what are you looking at on social media, and what pictures are you looking at, and what do you think your body should look like? Next. So just quickly, this goes back to why I showed you the demographics. So what we see in our data is people who identify, people who are in some kind of minority or historically discriminated against group are doing less well than people who are not. So the bar down the middle of this graph is that overall 23% of the kids in Norwalk in 7th through 12th grade reporting depression. Who's reporting depression at a lower rate? Males, straight people, cisgender people. Cisgender is like kind of the opposite of transgender. Their gender matches, you know, their gender identity matches the gender assigned at birth. But the transgender, the lesbian, gay, bisexual have much higher rates of depression, and also girls. And then the purple one is IEP, that's students in special education who have an individualized education plan. So thinking about kids and what group do they fit into, like if they're a white male, they may be doing better than you know, person of color who's a girl. And people can have multiple identities, right? And you could have several of the more marginalized identities, and you might really be struggling now. Next, or just at higher risk. So this is what's really important is all these marginalized groups, these kids are struggling more. They tend to be struggling more. It's not because of their identity. It's because of how society perceives them, or how they think society perceives them, how they feel they're treated by others, whether they feel that they are accepted and can express themselves for who they are. And generally people will report that they may directly experience bullying or discrimination, or they may perceive it just in the messaging around them all the time about what's normal and what's not normal. So that was to share some statistics. And now I'm just going to go on and go, so what, you know, what are some of the issues we see related to this, and what can we do about it? So one thing is thinking about, you know, what can we change in kids' lives? What are the protective factors to build up? What are the risk factors to mitigate? Just showing a couple. Yeah, please click. So one is, how connected are kids, right? Do they have trusted adults in their lives? Do they have friends that they can share their feelings with openly? It would be nice to think they could, you know, talk to someone in their family, but we should never assume that they feel that way. So we want all our kids to really be connected to someone. Is it a youth minister? Is it an aunt? Is it a coach? You know, but someone. Don't assume that they feel connected to their teachers. In Norwalk, what we found is that last time only half of kids felt connected to teachers, but that was, we surveyed during COVID. It really didn't get better this year. So there's, you know, if you think about the adults kids spend their day with, are there other people to connect them to? What about friends? And social connectedness is preservative, protective for all of us. And there are a lot of people out there who are lonely. So in Norwalk, we found that a significant number of kids had no adult to talk to, and some of them had no adult or peer that they could, that where the question was really where you can share your feelings with and talk openly. That's a high risk population. So that goes to like connecting people. What do we connect our teens to? Where do they spend their time after school? Are they exploring their interests, whether it's volunteering or working or, you know, doing their own project with a friend? Are they in clubs, or are they sitting home alone? What about exercise? Exercise is not just good for our physical health, but it's absolutely good for our mental health. There are countries like New Zealand where if you go into a doctor and report signs of depression, the first thing they do is tell you to exercise for 6 weeks and come back. And after that, if you're still not doing better, they might consider a prescription. That's not how we do things here, but depression and anxiety respond really well to exercise. So, you know, let's help, like, think about who your kids are involved with, think about what they're involved in, not in a way that's a burden to them, but help them explore their interests. It shouldn't all be about, what do I put on my resume for college, right? It should be, how am I exploring who and what I want to be? Something that can be a risk factor, absolutely, is substance use. So substance and mental health are kind of yin and yang, two sides of the same coin. Kids who are struggling with depression, anxiety, and so forth are absolutely, in our surveys, using substances more than kids who are not, because it's a negative coping skill. Conversely, if you are using substances, it, like alcohol is a depressant, right? I mean, these things might make you feel better temporarily, but overall they make your mental health worse. Believe it or not, these are the statistics for the Norwalk high schoolers. Substance use in a lot of our communities dropped significantly during COVID, because kids were wearing masks and they were at home and they weren't at parties, and it hasn't come back in a lot of communities. Of course, the rates are higher if you look at what percent of kids ever tried a substance and what about the 12th graders, but at least in some communities it's low. This is not everywhere. I know we've surveyed in other towns locally in the last couple of years, and alcohol rates were very high in some places. So these are conversations to have with kids, right? Next. Bullying is obviously a fact, can play a role in mental health. A lot of kids report not only being bullied, but that they don't feel like anyone has their back. So that's really a bad place to be. One thing we saw in Norwalk this year is, and we were surprised by, is kids reported that most bullying happened in the classroom. Online was the third location that they were likely to be bullied. Moving on. So the other factors, the other issues to think about are coping skills. I already alluded to exercise, but if you or your kid is struggling, diet, exercise, sleep, and spending time outside are all things that help, that really truly help, right? Connectedness to others, feeling meaningful and purposeful, like doing something that you succeed at and that you enjoy, like exploring hobbies, not just doing homework all the time, but having actual coping skills, like learning breathing techniques to manage stress, meditating, knowing how to manage your anxiety, structure and boundaries around your time management and all that. These are things we can help our kids with, help ourselves with. These are things that don't always require a therapist or medication, but also therapy and medication may be required. So I think those are questions to talk about. And then for the parents and the kids, awareness is so important. If we don't recognize that what we're feeling, if we think, oh, I just can't sleep at night all the time and have a stomach ache all the time, and we don't recognize that those could be signs of anxiety, how are we going to know that maybe the help we need is related to mental health? So there are training courses like mental health first aid, youth mental health first aid, teen mental health first aid. The Question, Persuade, Refer training, QPR, is a suicide prevention training that a lot of us here on the call deliver on a regular basis. I know we at Positive Directions have it online every month, and then we can do it for groups at any time. I really feel like everyone should be QPR trained. NAMI, the National Alliance on Mental Illness, who you're going to hear from later, has an incredible 12-week, once a week training from one family dealing with somebody with a mental illness to the other family, but in a group. So it's support, it's education, it's awareness. It's pretty amazing. I definitely want to put in a plug for QPR because it's only an hour and a half out of your life. Take the training, learn how to intervene if someone around you is suicidal. It's so much more common than you may think. We do a lot of trainings with kids in high schools, anybody age 16 and up. And I go into the class and I start off and I say, how many of you, like, raise your hand if you have tried to talk to a friend because you were afraid they were suicidal? And virtually every hand goes up. It's never less than half. They've tried to have these conversations. The kids might recognize that their friend is struggling, even though the adults don't know. And then you say, how'd that conversation go? And it's so awkward and scary for them, and they don't know if they do the right thing. And when we finish the training, 100% of them say, I know how to handle this better. So please take the time to do that training. And last but not least, I just want to move on to a couple resources, and some of them may be reiterated later in this conversation. Make sure your kids know about Teen Talk or about Kids in Crisis. They're based out of Greenwich, terrific resource in Fairfield and Greenwich and in Norwalk and a lot of our towns. They have free Teen Talk counselors who are crisis counselors in the schools. Your kids can walk in anytime. They do have a 24/7 hotline that you can call anytime, and they have shelter beds. It's a free service. I just realized I didn't put the helpline on there, so I'll put it in the chat. Oh, it's on the screen. Then what I want you to look at here is on the Help is Here flyer. These are flyers created by our Turning Point CT project that Santina mentioned. It's a statewide young adult mental health peer support group that I run. Take a look at the national hotlines. Make sure your kids have the crisis text line in their phones and or the 988 suicide prevention lifeline. They can call, they can text any time of day or night. They don't have to know if it's a mental health crisis. It feels like something they need to talk to someone, they should get online. The crisis text line or 988 can do work behind the scenes to not only support them or you, but if need be, they can connect to like the local police department and say, you need to do a wellness check over here. Just to point out, for the LGBTQ population, there are really specific resources that are incredibly valuable. The Trevor Project, which has text, chat, call, everything, the Trans Lifeline. And then those are all numbers that you can use anywhere. If your kids go off to college, these numbers all work. On the Connecticut resources, that's where the Kids in Crisis helpline is listed that I mentioned. I'm not listing all of them. I want to point out the last bullet under Connecticut resources is the Join Rise Be Warm line. That is a 12 to 9 every single day. Young adults in Connecticut, ages 18 to 25, who have personal lived experience with mental illness, but are trained as recovery support specialists. They will pick up the phone and talk for 10 minutes or 9 hours to someone who, you know, is basically an age peer going through similar struggles, and they are there for them. It's an incredibly valuable resource. So I'd recommend everyone just take a picture, you know, of this screen. And I think we're probably sending things out afterwards. And then the last piece that I want to share is hopefully everyone's aware of the regional behavioral health action organizations in Connecticut. The one for our region, for Region 1, is called the Hub. And if you visit thehubct.org, either the treatment page or the recovery page, you can download a complete list of all the nonprofit or specialty mental health and substance use providers, of all the free peer supports. It's an incredible resource. So thank you so much for your time. I went really quickly. I think we're not doing questions at all until the end. So hope that was helpful. And back to you, Santina.
Thank you so much, Margaret. And so if you have questions, just put them right in the chat and we'll get to them at the end. So next up on the agenda, we have the role of hospitals in mental health, role of hospitals mental illness with Dr. Jan Ponson. Dr. Ponson is Vice Chair for Clinical Affairs and Medical Director of Youth Services at the Yale Child Study Center. The Child Study provides in-home, specialty, and general outpatient care. He is also Medical Director of Yale New Haven's Children's Day Hospital, which serves children with high-level needs 12 years of age and under. He was past Medical Director for the Children's Psychiatric Inpatient Service and consulted to the Pediatric Emergency Department. He's an Assistant Professor of Clinical Psychiatry with the Yale School of Medicine.
All right, thank you. Pleasure to be here tonight. So you are sitting at home right now and you get a call from a parent and their child just heard that your child has been having suicidal thoughts and wants to kill themselves. And it's happening right now as we're speaking. Or maybe you're at home or you're working, going about your day kind of mindlessly, and you get a call from the school. Your child is here and they've just gone to the bathroom and they've cut themselves. Or maybe you're going for a walk and you get a call that your child is on their way to the emergency room through an ambulance. And so these are some of the incredible stressful moments that you have as a parent when you're getting involved with higher levels of care. And these things can happen very unpredictably. You may just have no idea that your child is feeling this distressed, or they're feeling these things. And at other times, you've been struggling with your child's mood and struggles, and you've been involved with outpatient therapy, and that's not been sufficient, and something more is needed. The something more is needed is a little bit more of a pleasant process than being caught off guard, but it's still obviously a very stressful experience for everyone, for all of us. Because all of us who are on this call or in this room, there are many, if some of us, if not many of us, who've had children with struggles. I'm going to go really relatively quickly through the slides. Let's see if I can make this work. Don't I press down arrow? Yes, I press down arrow. The slide is probably busy if you're on Zoom. It's just to say that emergency room visits have increased dramatically throughout the United States for mental health. That's the first slide. This slide shows that females in proportion to males have much more in the way of emergency room visits. So a greater percentage of emergency room visits are for mental health than ever before, and females are coming in more frequently. Females and adolescents, there's a negative bent, a negative affect, which is thought to be evolutionarily in terms of why in pre-adolescence and adolescence, females are more likely to have negative affect. Evolutionarily, you start to become someone who's capable of having children. The world is more dangerous. Pregnancy is a very high risk situation for you. So there's a thought that during early adolescence, there's a negative bent to be threat oriented at that age. Hormones are flying. And of course, social comparison is a deadly experience for children, very painful experience. And social media allows constant social comparison. So it's really hard to be a young adolescent female in this era, I think. Boys tend to be more on video games, which allows them to interact with their friends, to do something that allows them to gain a sense of mastery. But the frequent social comparison and posting on social media for females is very challenging. Emergency rooms are up. This is more local information at the Yale New Haven Hospital. This slide, looking at the slide, is not as important as just the general trend. Because we were so busy during the COVID pandemic, folks were spending time waiting in the emergency room for hours, sometimes days, for a bed. Whether it was up in Hartford or at Yale New Haven Children's Hospital, children were waiting days for beds. This has gotten better, which is a good thing. We also had a doubling of requests for our outpatient clinic services during the peak of the pandemic. We went from being able to see kids within 2 hours for emergencies, 2 days for urgent situations, and within 2 weeks for routine, quote, routine appointments. And that shifted to essentially a 6-month wait list. Very, very difficult. We've had parents calling, and we're the only place sometimes that has called them back to tell them that they're on a wait list of 4 months. It's very painful to tell families that. It is getting better, but the take-home message is if you are having worries for your child, it's better to start to be proactive early, talk to your pediatrician, get things in place, rather than depending on something you need urgently that is not available. And that's been one of the challenges of the pandemic. Things are not available immediately for high acuity situations. Tremendous rise in eating disorders as well. And body image concerns are magnified by the social media experience. So just to tell you briefly about the service levels that are available, you have outpatient services, you have in-home services, extended day treatment, intensive outpatient, inpatient, psychiatric, residential. There are many levels of care. There are others here that others may have heard of, wilderness programs. But in Connecticut, and in the United States, but Connecticut actually has a pretty vast array of services from outpatient to more intense services up to inpatient care. Accessing those services when things are acute can be a challenge, but there is a general availability. And this last slide here, which is a springboard for talking, is the experience within the children's hospital. So we have our outpatient clinic, we have the emergency room, we have a couple of partial hospital intensive outpatient programs. Those programs are daily, several hours a day groups. We have in-home services, our inpatient units, and then occasionally kids will end up in the medical service and need mental health support because of a medical condition, or they have overdosed and they are getting treatment for their overdose or their suicide attempt, which can range from broken legs to gunshot wounds to frequently overdosing. And so generally you will begin with an outpatient level of care. And if that is not sufficient to help your child, they'll be referred to more frequent outpatient care. If that is not sufficient, they will often be referred to intensive outpatient care, which is several hours a day, several days a week. So in our program, we have kids for 9 hours. We have regular family sessions and individual sessions and psychiatric care. So if anyone on this call has a child who's not doing well with outpatient, intensive outpatient is available, and that's typically covered by all insurance companies. And then in Connecticut, we also have psychiatric in-home services. A very well-known one is called Intensive In-Home Child and Adolescent Psychiatric Service, called ICAPS, where people will come to your home and provide mental health care for your child in your home. And so that would be for those of us who have children who are at home, unable to get to school at all, unable to get to an outpatient clinic for treatment, unable to make progress through an outpatient treatment, have had hospitalizations, and you need more support and they need more support to help with your child's improvement. In terms of the emergency room and the hospital, just a few more comments rather. Your child, if they come to the emergency room, will be evaluated by a behavioral health care specialist, typically in most Connecticut hospitals, almost all Connecticut hospitals. Some places have child-friendly areas like Yale New Haven Children's Hospital with all children, medical and psychiatric mixed, but in the near future, child psychiatric alone. So they have a place that's nice and not just hospital-like with lots of sounds and beeping. So they'll get a comprehensive evaluation. And if an admission is made, decided that admission is needed or recommended, then your child will be admitted to a child or adolescent-friendly unit where they'll be supported by licensed clinical social workers, nurses, psychiatrists, which is the opportunity for a comprehensive evaluation, 24/7 observation of your child's emotions, behaviors, interactions with other children, how they follow the routine of the day, how they structure the day. And it's very intense therapy that gets them often back on track to be able to access outpatient care without the intensity of feeling that they have. And I think I will leave my comments there. Thank you.
So next we have Tiana Brown from the Norwalk Housing Authority Learning Center. She's the assistant director there. She supports the program director in daily operations, provides professional development training, shares PD opportunities, and leads the program's SEL initiative. Tiana's background includes being a therapeutic support facilitator for the Bridgeport Board of Education and managing both elementary and middle level programs. Educational degrees include a bachelor's degree in history from Virginia State University and a master's degree in organizational leadership from Quinnipiac University. Tiana is passionate about teaching and encouraging others to learn concept and directly impact their lives. So thank you so much for being here today, and I will make you host so that you can share your screen.
No problem. Thank you for that introduction. Welcome, everyone. My name is Tiana Brown, and just like she said in the introduction, I work for Norwalk Housing Authority. I've been working for them for about 19 years, serving the youth, and now in a manager role. So I'm going to talk to you guys about returning to normal and supporting teens post-pandemic. So I have 3 topics I'm going to share with you today. The first topic will be, I will discuss that it's very important that we build stronger relationships between our teens and their parents. The second topic I'm going to talk about is how to strengthen teens' social connections. And the third topic I'm going to talk about how parents and educators can help youth learn to be more independent. So I got 3 ideas to share with you today, okay? Okay, I'm gonna skip through a few of these slides because I thought I had a longer time. We're just gonna get to the meat and bones, okay? First, I wanna talk to you guys about supporting teens as parents post-pandemic. I think I can share this with you guys because my daughter just graduated from Brian McMahon High School, and I was parenting her throughout the pandemic, and it wasn't easy. So I'm sharing this with you from an educator perspective, but also as a parent, right? I was home working from home while my daughter was homeschooling at home, and I was the parent looking at her with her cell phone on the side, trying to do work. And, chastising and saying, hey, put your phone away. You need to focus on school. So it wasn't easy to parent in COVID. And I guess it may not be that easy to parent after these kids been isolated into how to get them back into normalcy. So I'm just going to share a few points. One thing about me, I feel like parenting hasn't changed. It's something that is probably consistent, and the same tactics that have been successful throughout the years stay consistent. So I just wanted to remind you guys of certain tactics and parenting skills that just hold true, that will be helpful if we were parenting in the pandemic, post-pandemic, and even before we had to deal with the pandemic. So first, I want to refresh us on our parenting styles so we kind of can think about what our parenting styles are, or the people we serve parenting styles, so we can have an understanding of our parenting styles and then move to some more successful ways to parent our students or parent our teens, all right? So I have 3 styles here, right? We have the unengaged parent, right? The inconsistent presence. You have low nurturance, low expectation, low respect, right? So, that's an example of a parent that is just not engaged, disengaged. The child is doing whatever they want and the parents do whatever they want, and they live in the house, but there's no connection, right? We have the dominating parent, which is harsh and punitive, low nurturance, high expectations of their children, but have low respect for those children, right? And then here we have the permissive parent. The cool parent that wants to just be cool with their kids. They have high nurturance. They're always there. They're always supportive, whether it's negative or positively. They have low expectations of their child or children, and they have moderate respect for their children, right? And so the reason why I'm pointing out these 3 to get us thinking and kind of thinking of how our parenting styles. And to be honest with you, I think at times we are a myriad of all 3 at times. Sometimes, we're lean on one parenting style or the other, but I do believe that we're on a spectrum of all these parenting styles. So these 3 parenting styles, I think they have good intentions, but if we want to strengthen our kids during post-pandemic, we have to move to a stronger tactic of how to parent. So these 3, we know them, we're familiar with them, but we're moving to a more strategic and a more effective way of parenting. We want to positively parent our children, right? And now I'm telling you, none of this is easy, but it's good to have an understanding of what skills we should be doing with our kids that are effective, right? We want to be nurturing to our students, I'm always thinking of students, to our children. They need to know that regardless of whatever they do, that we're there to be supportive, that we're warm, we're encouraging, and as much as we can, because I know how hard it is to parent a teen, we need to be positive with them. We need to be positive and approachable and willing to listen to our children, even when they're telling things that may be uncomfortable, because they're relying on us for guidance, even during uncomfortable times. And especially during the time where they've been isolated and now they're returning back to school, they're returning to getting jobs. They need us to be there, a rock, a supportive, nurturing rock to always support them. Discipline. I mean, I know teens, they run away from discipline. I know they hate it because they're trying to figure out themselves and they feel like, well, I can make my own decisions. But we know we have to set boundaries and enforce limits with our teens within reason. So we have to recognize, no, they're not in middle school and they're not children anymore. But at the same time, they need limits and boundaries, right? And you do need it to monitor their behavior. You don't need to go and check their text messages, but you do need to monitor their cell phone usage, their screen usage, in a way where you're not punitive, but in a way that they know your expectations and that they know what you expect from them. All right, and respect. I think one thing with my daughter, now that's her first year in college, I had to recognize I had to respect her perspective on things. Oftentimes when my daughter would speak to me, I already made some kind of idea all up in my mind about what she's talking about. And she don't know what she's talking about because she's a kid and I probably did it already. So I probably won't listen quickly. I just want to tell her the solution. And one thing she told me was like, Ma, I'm just really looking for you to listen and to kind of respect where I'm at. And I know that was a very hard skill for me to do because I always want to solve problems. But I had to learn just to listen and to let her problem solve, because that's a skill that she's going to have to learn, especially now that she's in college. So it's really important for us to always kind of plan a balancing act with teens, knowing that they're not adults, but these are emerging adults, and that's how we have to treat them. Now we're going to talk about topic 2. We're going to talk about help strengthening teens and their social connections. So I just talked about how parents can be supportive and nurturing and kind and patient and try to work with their teens, knowing that they just went from a place of being home all the time, can't go outside, now going back to school, now connecting with friends they haven't talked to in a long time, now connecting to social groups or sports after school. So, how do we transition them now from being home and working and being one-on-one with us, but now connecting into the larger world and creating social connections? Okay, so it's really important as parents and educators to help our students be open to explore. Now that we're not in the pandemic, we need to help them and encourage them to go and visit and go to museums, go out to, with a group of friends, to go to the haunted house, or just encourage them to get out, get disconnected from their phones, and to get out and be social. So we want them to explore. As parents, I know they're teens, they push back on a lot of things, but as a parent, the summer and the spring are coming, take them to the beach. Go ahead and do Six Flags. Get your teen out, get them exploring, get them engaged with the world. That's really important. And it is really important to encourage them to keep those social bonds that are quite important to them, their friends, tell them to join groups. Sorry about that. To engage and join those social groups and oh my, this is my daughter. I'm so sorry. Okay. Sorry about that. That's my daughter. She can't get to me. She'll call me 7 times. So to engage and get out in those social groups, join sports, get engaged with even groups after school. You have certain LGBT groups at school. You have political groups at school. You just want to encourage the kids to get out there and be okay to meet different people, and don't be afraid to regain those relationships again. and strengthen their bonds with their friends. So over here, I have a 3-tier where, so you have over here, I talked about sports, clubs, and hobbies. It's really important that they do community work where they volunteer, they seek internships. You can participate in internships in high school now and seek different interests. If they have different interests, like for example, my daughter just took up crocheting. I never introduced that to her, but it's important that we get them interested in different things that they may like, so they're connecting back into the world. And also, because kids are always on their phone, it's important that we get them even connected with their family. Kids do need to spend some time, with their cousins, spend time with friends without their phones. And as parents, we're observing this. And so we have to encourage and kind of support them to get connected. Because if we don't do it in a way that's comfortable, they'll sit on their phone, they'll sit on their computers, they'll stay in their room, and they won't get out and engage. So I'm just sending the message that once we see our kids just isolated because they've been isolated for so long, it's on us to encourage them to get out there and be okay with them making those relationships and sometimes making mistakes, but we have to champion them to be okay, use their voice, get connected, make friends. And that is something that they're transitioning from the pandemic now being and returning back to school and returning back into the community. My third topic I want to talk to you about is parents and educators helping you to be more independent. And it's kind of streamlined from us being supportive and helping them just on a nurturing and a parenting role, then getting them out and having them engage with their friends, join groups and clubs. And now hand in hand, when they're out there making friends, they're on a basketball team, they have jobs, they have internships. How do we help them to be independent? Because they will be out there making decisions and, having experiences that they need support with. So this slide is talking about helping teens become more independent, right? You want to support your kids with making strong decisions. And oftentimes that's just listening to them at the end of the day. They may share that they have to make this decision or they have to get this done. They have to prioritize these things. We want to help them with supporting them and listening to them and giving them options and working through their problems to let them know if you make this decision, this outcome may happen. If you make this decision, this outcome may happen. And be patient with them to work it out and see what they come up with. Because when they're teens, that's the state that they're in. They're trying to figure out their world and they're trying to figure out how they can be independent and make their own choices with the support of their parent. Right? You want to give your child opportunities to be responsible. We can't do everything for them. So at home, they need to have chores. They need to be responsible for things. And we need to hold them accountable for actually just managing their academics and managing their responsibilities at home and giving them consequences when they're not responsible, right? As parents, it's quite difficult for us to deal with conflict with teens because they're always pushing back and they're always fighting. I recognize that my daughter's just like me. I have to get my point across and she had to get her point across as well. When I recognized it was escalating, I said, we're going to talk about this a little bit later because I don't think we're hearing each other. And actually to come back so we can work through our conflict constructively and I can actually take some time to reflect and listen on what the message she was trying to say after I have calmed down to really listen. So that's supporting independence. I think as parents and educators, when people show love and genuine care, it goes a long way with kids. Even when you don't recognize that you're making an impact on them, it does matter. So showing genuine interest on what's happening with your kids at the end of the day, going in their room. Yeah, they're gonna be like, what you're here for? What you want? But sit down and take that time and talk to them about what happened with their day. Listen to what's happening with their friends, because that is the plug for you to be a parent and kind of listen and try to help guide. So a lot of times when kids are teens, If you have a kid that doesn't make any problems, is kind of quiet, some parents kind of disconnect from their teens. And I really think that's an important time to really connect, because you don't know what's going in their brain. So you coming in and you're talking to them and trying to get an idea of their mindset is very critical when they're a teen, because they're about to be an adult. So really get in, show love, show concern, still hug your teen, still show your teen that you're still that parent that they were when they're little, and you were so supportive and you were so happy. Still continue to be that parent when they're a teen, because I know they're tough, but you still have to love on them and let them know that you will always be that supportive and nurturing person by their side. I did discuss making time to talk with them, right? And giving them space to be and grow, and do it with a monitoring eye. No one wants to be a fool and just let your teen do anything, but we can't invade their space, because that breaks trust, right? And lastly, I was emphasizing this before, say I love you, say I care about you. Yeah, they may roll your eyes or they may shrug off the love, but continue to dose them with that love. That makes a big impact. And they'll come and talk to you. Lastly, building decision-making skills, find out different options with your kids. If they're dealing with a situation of, I'm struggling AP, math, what are other options that they can take, talking to them, weigh out the pros and cons of a situation. And that can happen at night when you're just talking with them and reviewing their day, and they'll tell you a problem. And again, you can tell them pros and cons about it. You can help them brainstorm, what school do I want to go to next year? What college do I want to go? Or what kind of jobs I want to go to? Help them brainstorm, help them problem solve, and then support them through their problem solving. And be honest and be okay with giving your kid feedback, not in a critical way, but giving them feedback that makes them think. That's all I can say, because sometimes people may think it's criticism, but if you say it in a kind, loving way, they're going to take the time to reflect on what you're saying and say, I kind of understand what mom or dad were saying. They may not say it with you, but you may see it in the decisions that they make. So helping them become independent is, of course, one, staying in your parent role, always being supportive, always helping them, always guiding them and setting boundaries, but also still showing love and continuously letting them know. And I think I say this all the time, letting them know that you're by their side and you're that main person that will always be supportive to them. And lastly, you're helping them make decisions as a team. You're not making the decisions. And this is really important. All these skills are important. They were important post-pandemic, and they're very important now because they're re-entering a new world, and the world has changed in that sense. All right. Summary, returning back to normal. Like I said earlier when I was talking, help students reconnect with friends, join clubs, get connected, go to events, have them say, this is your world again, get connected to your world, okay? And as parents and as educators, we want them to know that you always have caring adults that will support you and adults that respect you, and it's allowing you to grow and to be. So I apologize for all the disruptions and the slides, but I hope this, these points will remind you of how to parent a teen and just sharpen your saw and get you thinking about how you want to approach engaging with your teens. Okay, thank you.
All right, so next we have two speakers from the National Alliance of Mental Illness. Our first up is Vanessa Elias, and I'm sorry if I mispronounce your name. So Vanessa Elias is the founder of Thrive with a Guide, LLC. She is a mental health activist, certified parent coach, speaker, and writer specializing in whole family synergy and well-being. Additionally, Vanessa serves as a parent support group facilitator for the National Alliance on Mental Illness and is the driving force behind community initiatives such as Free Play Matters Task Force, Wilton Mental Health Task Force, and Wilton's Big Block Party Weekend. We also have Beth Schweitzer. Beth is a licensed marriage and family therapist in Connecticut. Her areas of focus include life transitions, stuck relationships, family dynamics, parenting, peer stress, school stress, coping skills, career reentry, and self-esteem. In addition to her private practice, she is a clinical intake coordinator for the Bertram Group and a support group facilitator for the National Alliance on Mental Health. Previously, she was a staff therapist for the Norwalk Department of Youth Services and led NAMI groups at Norwalk Hospital for parents of at-risk adult family members. She is a certified in aggression replacement training and earned her master's degree in marriage and family therapy from Fairfield University and her bachelor's degree in operations research and industrial engineering from Cornell University. So thank you, guys. Do we have their
Having us.
slides?
Yep, thank you for having us. No, we have no slides. It's
Yeah.
easy peasy.
All right. So thank you. I'm Beth Schweitzer, and I'm just going to start to tell you a little bit about NAMI and about myself. NAMI is a grassroots organization. We're all over the US, and it's an organization that supports families who struggle. I've been facilitating NAMI support groups with Vanessa since we just figured out 2015, so a long time. I used to also do support groups at Norwalk Hospital, but Vanessa and I meet with individuals, parents who have children 21 and younger with emotional and behavioral struggles. My story, why did I come to NAMI and decide to do all this? I have 3 children, 2 with stigmatized illnesses. And when they were diagnosed, I was really private. I didn't talk about it. I made sure it was all covered up. Everyone saw a therapist, but I wasn't public about any of it. And I was afraid of the stigma. Fast forward, I didn't want anybody to make the same mistakes and to feel as lonely as I did, as my family did. So when I heard about NAMI, I wanted to really help families like my own. I wanted to support the parents so they knew there were people out there who struggled and that there was a light at the end of the tunnel and that we could be together and support each other. So I started doing that in 2015 with Vanessa. And started meeting with different people and trying to get the word out and supporting people. And that resulted in me going back to get my master's in marriage and family therapy, where I have a private practice. And I also work for the Bertram Group, which is a consulting firm where I hold the hands of families who are going through struggles like my family did. So thank you for listening to us today. Vanessa?
Thanks so much, Beth. Yeah, Beth and I met when we were both ready to help other families. I also, when I had been living abroad, and I have 3 kids as well, and my oldest had had mental health struggles, and I was really alone, and different country, different system. And when I moved back to the US, I knew that I wanted to be more verbal. I needed to reach out, just personally who I was. I needed to talk. And I'd said to a friend that I wish there was something like Al-Anon for mental health challenges. And thankfully she knew about NAMI, and she said there is. And I went to my first meeting in Stanford many moons ago, and I felt understood and not alone, and that I could speak openly and honestly about what was going on in my family for the first time without people looking at me, judging me, saying things like, "Oh, I would never tolerate that in my house." And I did, but so it was just a gift. And as soon as, we talk about 3 stages of emotional recovery in our meetings. And, when I was in a place and both of us felt like we could be activists, to help other families. And so we're facilitators. We're both trained to facilitate a meeting. It is a group. So we come together and look to each other for wisdom. But essentially any NAMI, our group is a NAMI CAN, which is Child Adolescent Network. So we specifically, as Beth said, help parents who have kids 21 and younger. And we all NAMI CAN meetings we're in from Fairfield to Greenwich is NAMI Southwest. And in all the NAMI CAN meetings, I want to tell you about ours, which is the first Monday of the month at 10 a.m. And since the pandemic, we've been on Zoom, and that's actually served well. So people just need to reach out to us And you can do that by going to the NAMI Southwest CT.org website. All the support groups are on there. So all the NAMI can, there's not just us anymore. There's also one every Wednesday morning over Zoom at 10 a.m. And now newly there is the second Thursday of every month in person at 10:30 a.m. at the Darien Youth Depot. And any NAMI can meeting that you would send parents to, or a parent would come to, virtual or in person, has the same format. We all follow an agenda. We have group guidelines that it's a confidential, safe space, and because that's what it is. And what's, as anyone knows, in mental health is so unusual, it's free. You can come and you can get support and you can meet other families. You can learn from other people's experiences. You can feel not alone. And so we go through the agenda. We have a check-in that we do. And what's really important about the check-in is you can share, your name, your town, your child's diagnosis, if they have any. What is your most pressing issue right now? Because every single person in that room, we've all had a journey to get where we are, but how can the group help you in that moment is what we are. And then a really important piece is our last bit of check-in, which is asking yourself as a parent, what do you need to do for you? And that is a question that most of us who have kids that have struggled with mental health issues don't think about. We are always thinking about everyone else. We're thinking about our family, how to help my child. And so many times parents say, what I need is for my child to be okay. But that's not something that we can control as parents. And we can't show up for our kids if we're not taking care of ourselves. So that question is usually, I know that I've cried in that because it's the first, in the past that it's the first time I thought about me. And so it's a really important piece of the group. And so those are the logistics. We have principles of support that we go through. There are 12. They are excellent because they are little mantras or affirmations that can carry you. I know personally I have used some of them. Numbers don't really matter, but number 10, it is number 10. My favorite, I always say, is that we accept we cannot solve all problems. And that is a comforting thing as a parent, right? You feel like you want to help and you can't, and learning to accept that, rejecting shame and stigma. So there are a lot of things that happen in a meeting. And again, it's a confidential, safe space that you can come and share and know that you're not alone and find support and resources, names of a therapist. This didn't work. Does anybody have ideas about this? It's a real gift. And Beth and I are so happy to have been running this for 8 years in Wilton. But NAMI also does a lot of other support groups for family members. It's not just for parents of kids, but family members. I know today's talk is about teens. They also have a monthly book club. There is a family to family class that is starting on March 11th in person in Greenwich. It's a Saturday morning and it's 12 weeks and it's also free. Thank you, Margaret, for putting NAMI southwestct.org in the chat. This basics class is not basics. This family to family class is also free. It is exceptionally helpful. It is evidence-based, which means it's scientifically proven to make things better and work. So go to the website and see all that is on offer in our area. And we also, Beth and I are available anytime, even if someone can't come to a meeting. Both of us are happy to give our time, and people can call or send an email and just help in any way we can and point them in a direction. Over the years, we've both spoken to hundreds of people.
You'd be surprised, right? How many people, and I love that, reach out to us.
Yeah, and that's what we're here for. So I encourage you, yourself, people or families that you work with, that we're happy to help, however we can, and direct them to more help. So hopefully we've helped you make up some time. Thank you for having us.
Thank you so much, Beth and Vanessa, for that. Next up, we have Amanda. Amanda is a parent of a teenager. She's going to speak about the resources she has used and how she learned to navigate through the mental health system.
Thank you very much. So I want to begin by saying that a lot of what Vanessa and Beth just discussed is kind of where I'm going to lead you next. My name is Amanda, and I'm not in any way a medical professional. I am just a parent of a teen that has gone through serious mental illness. And what I can talk about today is my story. When you talk about an illness, you have the parental experience, but you also have the patient's experience as well. And that is my teen's story, their own personal story. And together we have our story. What I want you to know is that I am a parent that is still currently in the trenches. My child is under 18, and with my lived experience, what I can share for you today is my story. I don't feel comfortable sharing theirs, so I won't discuss the diagnosis or anything like that, their name, any of that at all. So I am a parent of 2 children. Our oldest began exhibiting symptoms of a mental health disorder in 7th grade. Eventually it escalated to severe symptoms and they were hospitalized. They took part in an IOP. I think Margaret may have discussed that, the intensive outpatient program. And we spent the last 3.5 years building up a team to help our child, as well as now what I'm participating in, which is to try to help end the stigma by sharing my story. Once our child had been diagnosed and we were on our way to a treatment plan, I reached out to NAMI and I took part in a support group, and I took part in the family support group. And this is really for anybody. It could be for a parent, it could be for a partner, a spouse, anyone who is supporting someone who has a mental illness. And when we went around the room, I realized that I had the youngest child in the room. And the stories that I was listening to at the time of where I was in our journey was difficult for me. And I didn't go back. I waited. And then I found out about NAMI Can, which is the Children and Adolescent Network. And ironically, Beth and Vanessa were the smiling faces that I saw on my Zoom screen when I finally got up enough courage to attend it. And everything that they both discussed really happens. I mean, they follow a strict agenda. You have things that you are able to take away from that meeting and put into action until the meeting that happens next month. Prior to that, I was completely overwhelmed. And when I left that first meeting, I felt as though I had found people who really understood what I was going through. And there was a light at the end of the tunnel that I was not able to see. Vanessa mentioned the stages of the emotional recovery, and this is something that NAMI has you focus on during the meeting. And they are dealing with catastrophic events, learning to cope, and moving into advocacy. And you can transition back and forth between all of these stages depending upon where your child is in their particular journey. And I've taken those, but I put my own spin on them to talk about self-care. The catastrophic events for me is really survival mode. That's what my family was in. Our child was hospitalized, and my husband and I were meeting in the kitchen at 2 o'clock in the morning, eating chips, and I was crying. That's what survival mode looked like for me. And this was before I had found NAMI, certainly not good coping skills at all. But suddenly you are dealing with doctors and therapists and psychiatrists and pharmacies and insurance calls and the school personnel. Your personal schedule, work schedule is disrupted. And you're on a roller coaster ride and you cannot get off. So when you're in that type of a survival mode, what is the self-care that you need? Well, I say what you need is to focus on the bare minimum. Are you eating? Can you just put bars or fruit in your car or your purse or bag so that when you're running between different appointments, you're getting some kind of sustenance? Are you drinking water? Keep a water bottle with you. Are you getting enough sleep? Are you getting any exercise? A walk for 5 minutes, 10 minutes can make a huge difference when you are in that survival mode, whether your child is in the hospital or they've just come home and you're trying to support them. You know, there can be times, we heard earlier from the doctor, the amount of time that people have to wait to get to that next level of care, depending upon where they are in their own journey. Well, you may be waiting for that appointment with a therapist that's still 4 weeks out, but you have a child who needs support now, and you can't leave them alone for safety measures. So you need to be able to build a team and find people that can support you for 5 minutes or 10 minutes so that you can get just a little downtime, take a break from what's going on. But that's what's happening in survival mode. And to really think about things like, can somebody make a dinner and bring it over to you? My therapist always reminds me that when we're in survival mode, I may care about the environment, but paper plates work. And then I don't have to worry about the cleanup. And it's one less thing that I have to focus on. So trying to find what those simple things are when you're in that survival mode to be able to get to the next level. No doom scrolling at night because you can't sleep, things like that. The second emotional stage of recovery is learning to cope. And my lived experience really calls this your new normal. There's a book called Simply One Mom's Thoughts About Coping When an Adult Child Lives with Mental Illness. It's a long title. But in the chapter titled Embrace Your Normal, she writes, why was it that our story seemed so different? Our family wasn't focused on college and careers for the kids. Our family was focused on survival. Our growth as individuals and as a family seemed stunted. We seemed to be stuck. And at times we didn't know how to move forward. But she goes on to say, I've come to embrace our normal. And I encourage you to embrace your normal as well. When you embrace it, there is so much freedom to gain. It is what it is. No longer will you compare yourself or your adult kids to others. If you're like me, you won't want to. Stand tall on the foundation that you've built. It may have cracks in it, but those cracks are evidence you've survived and you're continuing to grow. So your new normal is normally seeing yourself in management role. You know, you've put together your team, you're dealing with flare-up symptoms, but the initial hospital visits and appointments have been managed and your child is hopefully back to school or in an IOP program. And instead of being on the roller coaster, you're in the booth, okay? So you're alerting people if the roller coaster is getting stuck, or you're encouraging your child to talk to their therapist or psychiatrist so that they can continue on their ride, but have it be less scary. In terms of self-care, one of the things you can do is focus on preparing for the next event. Because while we want to see recovery, while we want to see stabilization, and when you're in this learning to cope and your new normal, most of the time your child is somewhat stabilized. You still know that something could happen. Something could change. A medicine could stop working. There could be a trigger that sets something off. And you can actually end up going back into that survival mode again. So plan for that. And during this time, stockpile frozen meals. Find time to do something for yourself. Take a class, a coffee date with a friend, a dinner with your spouse or partner. Find a therapist for yourself. I told my therapist that I was going to be doing this presentation. And I said, other than putting up, go to a therapist, what else should I talk about? Because in terms for me, that is the biggest self-care that I do. I spend 45 minutes every 2 weeks, and it has helped me not only feel better about my parenting process with all of this, but also about myself. Utilize your support groups for caregivers. NAMI is excellent, but there's a lot in the area as well. And if you Google, you will find them. And consider taking the family to family that Vanessa spoke about. I did that. I did it online. It was a great program. I'll tell you again, I signed up for it when I was in survival mode and I stopped taking it
it was too much for me. I couldn't take it in at that time. But when I moved into this learning to cope, I did a much better job of being able to take everything in. I've made friends across the nation then. We text each other. These are people that really understand what it's like to go through this and can support you. Another thing though, is to focus on doing things with your child that are unrelated to their diagnosis. You know, take this time when things have stabilized to make memories, to create worth it moments, so that you have something that when you get back to survival mode, you have that connection like Tiana spoke about, that you can call on to help them get back to their stable period. And the final stage of recovery is moving into advocacy. And it helps you find meaning, a sense of empowerment, and you may become active in mental health, but it also helps to give you hope. For me, and I think you've heard a lot of people refer to this, it's really about ending the stigma. And if we apply self-care to this, I believe helping to end the stigma is a form of self-care. You know, when you care for someone with a serious mental illness, you're living in a world that many others can't contemplate. And due to the stigma, as Beth spoke about, it's very, very difficult to talk to anyone about it. While it is getting, you know, incredible coverage now and events like this are happening, which is amazing, it's still very difficult when it first happens to start telling everybody what it is that you're going through. So start small. You pick one person to talk to about it, a friend, a coworker, a therapist, someone that you trust. Share information on social media about mental illness in general. That sometimes gets the ball rolling in terms of helping to end the stigma. Become involved in organizations like NAMI. They're always looking for volunteers. There's the Youth Mental Health Project, my friend Abby, the American Foundation for Suicide Awareness, or any diagnosis-specific organization. Get on their newsletters and share information from them on social media. Part of doing that too helps you learn more. And when you have more knowledge, you feel more empowered. And for me personally, that's a form of self-care as well. So how does sharing help? There's a famous quote from C.S. Lewis about friendship. When you say to somebody, "What, you too?" I thought I was the only one. For me, it was a friend from high school who I refound through Facebook, and we have a shared lived experience now. She was incredibly brave and shared her story with me, and I felt brave when I shared mine with her. And now we can honestly support each other. So having that just one person in your friend group that you can reach out to that's outside of your family, because your family knows what's going on. Your spouse, your you know, the grandparents, aunts and uncles, they may be aware, but it's important to also have that friendship support as well. And self-care doesn't just come in manicures and spa days. You know, it can be crying on a friend's shoulder and them saying nothing other than "I understand." That can be very, very helpful. So I've never publicly discussed my child's struggle in school and their diagnosis on social media, but I've shared a lot of mental health images and stories, and I've raised money for my friend Abby, and I've done the NAMI walk. By doing that, I've received DMs from people on my friend list asking for help. I've referred a couple of them to Beth and Vanessa through NAMI. It allows people to privately contact you and say, "Hey, do you know anything about this?" And that helps them get the support that they need for themselves or for their loved ones. Ending the stigma does not mean signs on the Capitol steps. It can mean just one person, changing the view of one person, and then having that ripple effect, how that affects that next family and how they help that next family. And it helps you see how far you've come. You know, I think about my first day in that NAMI CAN support group. I think I cried also when they told us that we needed to talk about what we were going to do for ourselves that week. I couldn't think of anything. I was so focused on my child and supporting my child, it was very, very difficult for me to think of something that I could do even for 5 minutes. But I take a step back now, and 3.5 years later, I'm standing here telling my version of the story. And it's incredible to see how far my child has come. They'll be graduating from high school this year, from a time when they couldn't even step into a school. So I can't impress upon you how important it is to find ways to use self-care when you're a caregiver. It's difficult to find time for yourself. You feel guilty taking that time away from your loved ones, but focus on those basics. Go back to, what are you eating? Are you drinking your water? Are you exercising? And then build from there. And it's not about the what, or even how often. Daily is great, but if you can't do something daily, you can't. But focus on yourself just in a short amount of time, and put on your oxygen mask first. My husband uses long walks with the dogs in the woods. That's his way to do self-care. Everyone has a different way. You can use art, you can use music, you can use games and puzzles, binging your favorite TV show. Whatever it is that you need to do for yourself is okay. It's allowed. And it's necessary in order to get up the next day and fight the good fight and fight the demons that you can't see. I'm going to leave you with a quote from one of my favorite people, Fred Rogers. Some days doing the best we can may still fall short of what we would like to be able to do, but life isn't perfect on any front, and doing what we can with what we have is the most we should expect of ourselves or anyone. So thank you to Region 1 for inviting me back again. I really appreciate it. And thank you to all the speakers.
Great. Hi everybody. My name is James. I'm a senior at Fairfield Ward High School. I've been a part of Fairfield Youth Cares for 2 years now. And I've had the privilege to engage in a lot of different mental health related activities with the club. But I'm here tonight to share one in particular with the rest of you. So I'm just going to present my screen. This fall, I organized an activity for my high school. So the goal of this activity, in a broad sense, was to prevent suicide. But I was really inspired to do this after a classmate of mine committed suicide just this previous summer, and before that, another one had passed away the year before due to the same cause. And I remember feeling very disturbed that so many people in my school community could feel so isolated and hopeless, yet show no outward signs of that. So this activity was inspired. This bracelet activity that I organized was inspired by two things. One was my understanding of the power of peer support networks. Studies have shown that the secret to a long, happy life is these peer relationships. So it seemed to me that the relationships were going to be the best way to address the mental health struggles that were so pervasive in my school community. I was also inspired by the success of mental health awareness sweatshirts that were sold at my high school a year before. And long after this sale, I saw my peers wearing these sweatshirts around school, and they always reminded me that I had people there and resources available for me if I was struggling. And this seemed really powerful to me because I couldn't imagine how impactful this could be to other people. So with this bracelet activity, I hoped to create a tangible reminder like the sweatshirts that would inspire those relationships and peer support networks that are so vital to mental health. So my vision for, my vision was, to do an activity with bracelets with the words imprinted on them, "Here for you." And the idea was to have students write their names on the inside of these bracelets and exchange them with a classmate. And this classmate would have this bracelet, and it would serve as a sort of tangible reminder that there are other people there for you if you are struggling with mental health issues, and that you can reach out to these people because they're there for you. But it's worth noting that this vision was made possible by a grant from the My Friend Abby Foundation. And I just want to say how extremely grateful I am for them enabling me to do this, because it wouldn't have been possible without them. So I got approval at my school for this activity. I ordered the bracelets for every student and distributed them to all the homerooms. And I got approval and organized a school-wide Google Meet that all the homerooms joined. And there was a presentation that took place on this meet. So this presentation featured information about the importance of peer support networks, as well as resources for suicide prevention. And I was lucky enough to have Gillian Anderson of the My Friend Abby Foundation, as well as Jim Cookso of Kevin's Afterglow, to come and speak about just the importance of being there for your friends and also just being there for yourself, recognizing how tough mental health issues can be to overcome and how you don't have to do it alone, how your peer support network should be utilized in that process. So after this information was presented, the activity ended with the exchange of bracelets with the Cure for You messages printed on them. As I said before, students wrote their names on the inside and exchanged them with a peer. So like I said before, I hoped that in this way, the bracelets would serve as a tangible reminder to anyone struggling with mental health that they do have a peer support network and that they should utilize that peer support network in order to overcome their struggles. So in terms of impact, I was very satisfied with how this activity was taken by the student body. We received a bunch of testimonials in a Google form. So these are some that I'll share. I won't read all of them, but one student reported that this activity made them more aware about how to help others, friends and family, as well as that they could consult those other people. So some people, the bottom review is from an individual who wasn't aware of the resources that our school had in order to deal with available to deal with mental health struggles, and that this activity made them aware of all those resources and made them more likely to use those resources in the event that they were struggling. And there were countless other students who reported that this activity made them feel more comfortable with reaching out to other people, or just made them aware of the importance of peer support networks and helped them identify their own. So, in conclusion, I think this activity really achieved its goal of making people more conscious about the importance of peer support networks. And I think that tangible reminder piece was also achieved months after the activity. I still see some of my friends wearing the bracelets around with the names of some of their classmates written on them. And, that warms my heart a bit, because I think that if this activity could just make a difference in, one person's life or two people, then the whole thing was worth it. So I just like to think about that. And, sometimes I just read these testimonials about, the impact it had, because it's meaningful, and it makes me feel good to know that, the activity was received and that it made a difference. That's about all I have today for this. If there are any questions or anything, I'd be happy to answer them.
Okay, I'll talk about. So something I didn't mention on the slide was the fact that we had the privilege to send these coloring books to our schools in order to, during midterms, in order to give students the access to, like, color between tests. And I just like in the libraries, and personally I was like in the library between test periods, and I actually found them like people like actually like taking their time and like actually like using the resources. And this also like weaves into the first slide I had. Okay. So actually the first thing that we did was one of the team members like created a card, and in this card she was able to design it and put in a QR code. All right, so here are the cards that I was talking about. So like with the QR code and everything. These are the schools mentioned, like Ludlow, Ward, like Walter Fitzgerald. And it kind of just like shows like how it's like okay not to be okay. We actually still have these up in our schools, even though like we had like placed them at the beginning of like last year. And like some people have actually like wrote and like actually like written like messages on it, like saying like actually like this is like helpful, like stuff like that, like encouraging messages on these cards. And I don't know, I just thought like this was like reassuring because like on top of like the midterm like coloring books, like I feel like all these like things like add up into our school, and I feel like it's become like a huge success. And especially when I don't know, like the name like keeps popping up, like I feel like people are getting like normalized with like our club. So I think that's um, good thing. So another event that we had was the anti-vaping event. So we actually went to Wakeman, the Girls and Boys Club, and we met with these middle schoolers, and we gave them like a presentation, like slash lesson about like all these, like about the dangers of like substance abuse, specifically vape. We showed them like the effects on the body, like with like actual like with like an actual like like an actual presentation, and like we had like these vapes to show them, like, and like we went over like the nicotine and everything, and they actually were able to come together and create campaigns at the end, which I thought was pretty funny, because they were all able to like collaborate together. As you can see, like all these different like ideas were like placed together, like all these different people were like able to collaborate or like create their own. And I just thought it was like a great way for like like middle schoolers to just like come together and like realize like like we don't want to be like the next generation where like we also get like addicted to another like substance. Another thing that we had done is like a feature in a radio PSA about mental health and substance misuse prevention. Yeah, so we actually were able to cover topics, and we kind of just like like we all had like different topics to talk about, like how like it affects the family, like your own health, and like even just like every every like part of your health, like how that like was covered, like and how that was influenced with the substance abuse, like that could result, and yeah, I thought that was a cool experience. Another thing that I thought was very successful was the wellness fair. It had like the notion of calm for the community, and it was kind of just a way for like people in the community, obviously, to come together and like try to like calm the mind. So we had things like creating stress balls, like yoga, cornhole, and like we had like these like different like sensory materials, kind of just like sand, like and everything, like and yeah, so these like I think tell in the pictures, like there was actually the people that were like willing to take time out of their day and like actually just like live in the moment and kind of just maybe that's fine. Yeah, just kind of like live in the moment. And yeah, so the next thing, we had a food drive, and people were able to donate food and come together and play golf afterwards as like a fun little thing. And these are the results and the pictures, and yeah, like and then the last thing I'm going to mention is the Harvest Festival. We actually just had like a booth, and we were able to give out all these like free resources to anyone who came by. I think that this was like a very great event because like like all these like people visiting for these like for this festival, like even just like like these grandparents, like parents, like anyone who ever care, like anyone that cares for like someone else, like I don't know, they were all like trying to like get like resources and like making sure that like that there's always like another way, like there's always like something that like that's like able to be like provided in order to like not in order to avoid like these in order to avoid like substances and like other like mental health issues. Like there's always another way, and there's always like another, you know. All right, so that was like the last slide. I'm so sorry about all
No, Emily, you did great. Thank you so much to you and James for sharing those resources and for being such a support for your peers.
Okay, I want to say thank you to all of our presenters. Our whole intent tonight was to provide everyone on this call with some resources that they can access, with some support groups and some support systems, and to provide some information that may have been useful to you, to your families, to your friends. And we hope we've done that today. I know we are over time, but I do want to allow for a few questions. If anybody has any, and I do want to echo what Santina had said, that our students on this call, James and Emily, I'm always impressed to hear what our students are doing in their schools and how they're trying to get their peers involved and everybody to feel that support and that love. So I thank you guys for what you're doing. It's really great to have student support. It's really great to have all our speakers as well. So I'm going to quickly just scroll through this chat really quick to see if anybody put any questions in here. But if anybody wants to ask a question right now, feel free to unmute yourself. I see that there was a question regarding some activities in Norwalk that people might be able to get involved in. And thank you, Dr. Posen and Margaret, for answering that and providing some support as well, some suggestions. Does anybody have any questions before we end? Again, we are recording this and it will be available. If you have questions when you leave this meeting tonight, as you think about it, you can always email me at sjacozzi, JACOZZI, at trumbull-ct.gov, and I'd be happy to send those to our presenters if there's something specific. I am sure they are going to be willing to help us and to help you with anything that you need. So as I'm seeing no questions or no hands. All right, well, I want to thank you all again. Thank you for staying with us an extra half an hour. I do appreciate that. Again, I hope you found this useful. And if any of your local health departments could be of use to you or a resource, please don't hesitate to contact them. If anybody wants the slides afterwards, again, you could just email me or contact your local health department and we will make sure we get those to you. Thank you, everybody. Have a great evening and enjoy the weekend.